A warm welcome to you all for joining us tonight for this webinar, The Inclusion of People with Disabilities in Social Protection for COVID-19 Recovery and Beyond. I'll be your moderator tonight. My name's Felicity O'Brien and I work in the Social Protection section in the Human Development and Governance Division in the Department of Foreign Affairs and Trade. Today we will have two sign language interpreters signing in international sign language for you. And along the bottom of the screen, you will also see the option to turn on your closed captions. It's on the right-hand side of your screen down the bottom. We'll be recording the webinar today, and that will include a full transcript of all the discussions and slides, which will go up on the socialprotection.org website in the following days. So this is the 30th webinar of the Social Protection Responses to COVID-19 webinar series. The series is a joint effort initiated by the International Policy Centre for Inclusive Growth on behalf of the German Federal Ministry for Economic Cooperation and Development and the Australian Department of Foreign Affairs and Trade. This series has been a collaboration with the aforementioned partners, the socialprotection.org platform, and also in cooperation with other partners and organisations. The webinar series is part of an initiative with two other major components: a collaborative mapping of country news and documents disseminated weekly through a dedicated newsletter and documents. These are disseminated weekly through a dedicated newsletter and an online community on the topic to systematise information and foster discussion. Join the online community Social Protection Responses to COVID-19 Task Force to learn more about the webinars and find out how you can collaborate and keep updated on all the future webinars. The next webinar of the Social Protection Responses to COVID-19 series will take place on Thursday, the 10th of September. The focus for this webinar will be on gender-based violence and social protection responses. So don't forget to register, and you should be able to do that in the chat box sometime during or after the webinar tonight. So we have a fantastic and diverse panel of speakers for you today, who I will introduce shortly. The format for the webinar will be, first of all, an overview of social protection response to COVID-19 and key elements to consider for COVID-19 inclusive recovery. And then we'll hear some country perspectives from representatives from India, Kenya, Timor-Leste and Indonesia. And then at the end, we'll have a question and answer session to finish up. So introducing our panel tonight, first up we'll have Alex Coates, who is from the joint UNPRPD, ILO and UNICEF Inclusive Social Protection Program. Alex is the co-founder of the Centre for Inclusive Policy and participated in the negotiation of the Convention of the Rights of Persons with Disabilities. He's been working tirelessly on these issues ever since, and currently he's involved in coordination of the joint UNPRPD, ILO, UNICEF Inclusive Social Protection Program. Then from India, we have Meenakshi Balasubramaniam from the Centre, co-founder of Equal Centre for Promotion of Social Justice in Chennai, Tamil Nadu. After our Indian representative, we will have Fatma Wangari from Inclusion Africa. Fatma is a mother to a daughter with an intellectual disability. She is the regional coordinator for Inclusion Africa, which is a pan-African regional network of persons with intellectual disabilities and their families. She is one of our Bridge Convention on the Rights of Persons with a Disability and Sustainable Development Goals, DPO lead trainers in Africa. We also have Josito dos Santos from Reis Hadumi, Timor-Leste. Josito has been active in the promotion of the rights of persons with a disability in Timor-Leste for some 15 years, first with the Leprosy Mission and then with the National DPO RHTO, which he established with partners. Josito is a lifelong learner and is also studying law at the Peace University in Delhi. And we thank Josito for missing his classes tonight to be here with us. Karishma Huda from Mahkota program in Indonesia will be our last speaker tonight. And Karishma works as a social protection and labour market specialist with Makota, an Australian government funded program supporting the government of Indonesia to improve its social protection system and policies. She has a special interest in the life cycle based social protection issues for children, the elderly and people with a disability. So we encourage the audience to send in questions during the webinar tonight. We will try our best to address all the questions in the Q&A session at the end of the webinar. If we don't get to all of them, we'll make sure that we prepare some written responses to the questions, which will be published on the website along with the recording of the webinar in the next couple of days. Please also find in the chat bar a link to join the Social Protection Responses to COVID-19 Task Force, the online community through the sp.org website. You can also participate in the follow-up discussions about the webinar by logging on to the website. So COVID-19 has highlighted the inequality gaps and disempowering structures in all societies, drawing attention to the reality that people with disabilities in particular have been living in the intersections of poverty and exclusion for too long. Most persons with a disability do not have social protection coverage, and estimates are that less than 30% of people with a severe disability globally have any social protection coverage at all. It is, however, an exciting time filled with opportunity for us all working in the area of inclusive social protection. There is a definite increase in focus on discourse around social protection systems and policies and how to ensure they are including as many citizens as possible who are vulnerable to falling into poverty, including persons with a disability. Tonight, we will hear from our speakers about the gaps, the barriers and the opportunities that they are seeing to the full inclusion of persons with disabilities in social protection and complementary services to ensure their full, dignified and effective participation and inclusion in our societies globally. So without further ado, I would like to now pass over to our first speaker, Alex. Take it away, Alex.
Thank you very much, Felicity, and thanks to all of you to join us. So as Felicity just mentioned, persons with disabilities across countries and regions were facing severe inequalities before COVID-19 crisis. Compared to persons without disabilities, across the life cycles, persons with disability are more likely to be poor, to face catastrophic health expenditure, to be victim of violence, and they are less likely to be economically active, to be resilient to shocks. We have seen in the last financial crisis how in OECD countries they were among those who lost most work and had most difficulty getting back in the labor market. And they are also less likely to attend and complete primary and secondary education. Persons with disabilities face barriers and lack of support across countries and regions. And those generate extra costs that prevent their economic empowerment. They may have to spend money on specific disability expenditures like assistive device, personal assistance, sign language, or they will have to spend more on general items. Healthcare is a big issue, but also transportation. Since most public transport are not accessible, they often have to use private mode of transportation, which generate extra cost. And there are a long list of specific general items on which they have to spend more. But they also face significant indirect cost. Less employment opportunities, less education opportunities, and resulting in lower earning for persons with disabilities, but also for their household. We know that in average, households with persons with disabilities, especially children with disabilities, tend to earn less income than those without disabilities. And one of the key reasons is basically the fact that there is a loss of earning or education opportunities for family members who provide support and are caregivers. And those disability-related costs can have different impact, depending on the way we measure them. I just project on the screen a graph representing the disability-related cost in South Africa 2015, as estimated by one of the few studies we have in low and middle income countries. The blue bars show the minimum cost. It's basically cost faced by people staying at home, where most of the support is provided by family members. The orange bar show the cost that people face when they try to participate. And we are not talking about extravagant participation, but just education, seeking work, accessing basic services. And what we see is that for the diversity of persons with disabilities, the minimum costs are often below the poverty line. But as soon as people with disabilities seek participation, trying to find a job, to keep a job, or to access basic services, their disability-related costs skyrocket. 4 times the poverty line for blind people, 7 times the poverty line for persons with physical disability with high support needs, up to 15, 16 times the poverty line for deaf people and persons with deaf blindness who need sign language interpreters. And those disability-related costs are not really taken into account, neither in eligibility determination, nor in the design of benefits. So what do we expect from disability inclusive social protection? Providing basic income security, covering the cost of accessing healthcare, including rehabilitation and assistive device, coverage of other disability-related costs, including support services such as personal assistance or sign language interpretation, but also facilitate access to early childhood development, education, and economic empowerment programs. One of the big issues we face is that in low and middle income countries, the coverage is basically very low. We have less than 1 in 5 persons with significant disabilities in LMICs that have access to disability benefits. In sub-Saharan Africa, Southern Asia, the coverage is below 7%. And it's of course reflected in the level of spending. OECD countries, in average, spend around 1.4% of GDP on disability-related benefits, while there are only 6 low and middle income countries that spend above 0.4% of the GDP. So what have we learned from the COVID response so far and the crisis? Obviously, there is a significant gap in support and capacity to respond, as most social protection systems in low and middle income countries are not designed to support persons with disabilities. They are a major challenge for countries without up-to-date national disability registry or disability equal opportunity cards. And we will come back to this point a bit later, and also in the different example from my colleagues. But we saw also that countries who have a universal or quasi-universal disability allowance, basically they have an effective tool for short responsive social protection. They can quickly provide top-up, which will support persons with disability as well as their household, which in most of cases are very vulnerable. So if we look at the overview of social protection measures, and we did a first overview in May, and we are about to publish another one based on the different trackers that exist internationally and the feedback we got from the field. Over 195 countries that have announced social protection measures, 75 had a specific focus on persons with disabilities. Unsurprisingly, the most frequent intervention was basically a one-off cash transfer intervention, which may have been advancing payment or a top-up. Few countries have expanded the number of disability allowance beneficiaries. For instance, Rwanda, Lesotho, Sri Lanka, Kenya, Bolivia, or more recently, Tamil Nadu in India. Not all those cash transfers are individual cash transfers. Some of them are household cash transfer for vulnerable household, which may include a person with disabilities or others like older person. There have been also administrative measures of interest. For instance, in Brazil, there has been an agreement to pay in advance the disability allowance while people wait to be able to have their disability assessments. As we know that in most countries, disability assessment determination is a key issue, fairly complex often, that takes a lot of time. And so in Brazil, Russia also, there has been some streamlining or different measures made to speed up the access to the benefit while this process is ongoing. There has been also several countries where there was specific in-kind support. For instance, in Mauritius, they have announced the fact that they would distribute food directly at home for persons with disability that benefit from the caregiver allowance, with the assumption that they might not be in position to procure themselves the food and get to it. In Peru, for instance, like in some other countries, there has been put in place a specific helpline to reach out to persons with disability and try to connect them with different support services. However, the feedback that we get from regional consultation we have carried out with DPO's Organization of Persons with Disability in Africa, South Asia, Southeast Asia, provide a mixed picture, of course. There are challenges in getting accessible information, both with regards to COVID-19 health response, as well as social protection measures available. But DPOs were saying that some efforts have been made. For instance, in many countries, for the first time, there was sign language interpretation on TV for the key news. But still, a lot of work remained to be done. With regards to access to general support, for instance, food distribution mechanism for the general population, again, there are significant challenges in accessibility, but efforts have been made. For instance, some form of priority may have been given to holder of the disability card in some countries, trying to have specific spot for distribution in some others. But overall, as I said, we have a very mixed picture. One of the key challenges we highlighted already is the fact that most low and middle income countries do not have a specific cash transfer for persons with disabilities. And if they do have one, it's often with very limited coverage, with schemes that are for poor person with severe disability who cannot work and can't take care of themselves, which is really a paradigm based on incapacity to work rather than a paradigm based on support to participation and inclusion. So with a very narrow focus, which basically limits the responsiveness in the crisis and will have limited impact with regards to the recovery. One of the issues we mentioned is the lack of outreach in countries who do not have a national disability registry or a very limited one. But we have seen in different countries, government reaching out to organizations of persons with disabilities to get their list of members and try to work together, for instance, with local authorities to identify more persons with disabilities in the community. And it was already the case before COVID-19, but in most low and middle income countries, there is no publicly funded support services, such as personal assistance or sign language interpreters, which was already difficult before, but has been particularly painful during COVID-19 due to the disruption of informal support during lockdown. So what are we looking forward, and what are some of the conversations we see happening? So ensuring that economic recovery programs are inclusive of persons with disabilities and their families. This is a very important element. In some countries, as I mentioned, the paradigm of incapacity to work is dominant. And for instance, there is not much effort made in cash for work programs or other type of program to ensure that persons with disabilities can access those economic empowerment programs, which are really critical in the recovery. There is an urgency to develop broader and universal national disability registry, which would assess support requirements and help governments tailor response and design better social protection systems that are truly supporting inclusion. One of the key issues we see, and we will hear about it more, is the fact that those disability assessment procedures are often complex and not carried out at local level, which means that many persons with disability, especially in rural areas or remote areas, or persons with complex impairment, usually miss out. And they are probably among those who need the most support. So this is really something to rethink, and we are trying to develop a thematic guidance on this. Most importantly, there is a need to combine mainstream and disability specific schemes to ensure basic income security, access to healthcare, and coverage of disability-related costs across the life cycle, with schemes that are compatible with work, so that people with disability who face disability cost, trying to find work will be able to get the support they need to be economically included. We need a greater accessibility across social protection delivery mechanism and invest in the development of community support services. One element that we've seen in Europe and other OECD countries after the last crisis is austerity measures that have hurt persons with disabilities, which need to be avoided in the recovery fiscal consolidation. We have developed already some key documents around disability inclusive social protection, and in the coming months, we will issue more thematic papers, which we will share with you on socialprotection.org and other media, and we are looking forward to continuing this conversation. Thank you very much.
We're just going to pause for a second before we hear from Meenakshi. The sign language interpreters are just catching up.
Okay. This is an initial analysis of India response to COVID-19 and persons with disabilities. This report has been acknowledged by DPOs, many DPOs in the country. So most of it will be repetition of what Alex said, but this is a good case study to see. One of the report done by one organization in India, Lockdown and Left Behind, has found that nearly 57% of the respondents expressed financial challenges because of lockdown and loss of work. 78.9% said that they have no accessibility to COVID-related information and communication. 42.1% of the respondents said that they did not have access to support services. All this has led to high risk of isolation and starvation, and death has been reported in media. So what is the response of the government to the situation? Overall, the social protection measures at the union and at the provincial level includes cash transfer, supply of food and provisions, moratoriums on loans, particularly micro, small and medium enterprises, waiver from duty for certain population, and helplines related to COVID-19 and health-related services. Specific response to persons with disabilities include, at the union level, one-off pension through the National Social Assistance Program, which is a top-up to this program, which is paid in 2 installments in 3 months. Apart from this, union has come up with a guideline to ensure accessibility of services for persons with disabilities. At the provincial level, the state governments have advanced the state-specific cash transfers in some states, not in all states. They've also come up with specific helplines. Apart from the general food supplies and rations and exemption from frontline services, in Tamil Nadu, one of the state in India, they have announced a one-off cash transfer for all persons with disabilities in the state with disability ID cards. But what we found through our report is that the efforts have been too little and too few because children with disabilities are not covered. And only 7.6% of working age population of persons with disabilities are covered by the Indira Gandhi Disability Pension or the National Social Assistance Program, which is used to provide COVID relief. And the survey conducted by that organization revealed 63% of those surveyed did not receive this pension. Why do we say that the support is inefficient? Because there was very little effort or no effort on the part of the government to address the pre-existing barriers in the design of the program, which mandates access only to those with over 80% impairment and those who belong to families below poverty line and prove incapacity to work. And also there are barriers in accessing the disability ID cards. All this has led to low coverage, and we found that nearly in as many as 34 states, Less than 10% of the working age population of persons with disabilities are covered. And I presented by way of India map with state boundaries in different shades, ranging from less than 1.39% to greater than 11.2% in 5 segments. Similarly, we found inadequacy of benefit in comparison to 1.90 per day poverty line per person. We found that in as many as 22 states, put together, the NSAP and the state-specific cash transfer amounts to only 20% of the poverty line. Again, I'm presenting it by way of India map with state divisions, ranging from less than 14.04% to greater than 46.37% in different shades. In Tamil Nadu, we did a rapid survey and we found that at least 60% of the respondents do not have access to the benefit, though it's announced for all persons with disabilities. And among the respondents who received the benefit, 56% experienced challenges in accessing the benefit. And 67% of those who did not receive the benefit expressed that they failed accessing because of lack of implementation process. Further, we found that the public expenditures to support persons with disabilities on social protection amounts to only 0.03% of GDP or 0.18% of public spending. And public expenditures on social protection, employment, and education put together amounted to only 0.04% of GDP and 0.22% of public spending, which is inadequate to address the pre-existing inequalities and marginalization due to gender, ethnicity, and place of living. So we propose expansion of pension, both in terms of value and coverage to all persons with disabilities, streamline and ease the access of disability ID cards, compensate disability additional costs for children and for persons experiencing high restriction in participation, ensure accessible information and communication and other forms of services, take steps to collect data on persons with disabilities at all levels, ensure community-based rehabilitation services. Thank you. Thanks.
Hi everyone, we'll just pause again so that the sign language interpreters can catch up. And next we're going to hear from Fatma from Inclusion Africa.
Can I start?
Yes, you can start, Fatma.
It says I cannot share my screen, so I will need help with somebody helping me to share the screen. Good morning, good afternoon, good evening. Thank you, Felicity, and thank you all for joining us today. I am humbled to share my experiences right from the African context to the Kenyan context. So going straight into the presentation is that, with less than 7% of persons with significant disabilities accessing disability-related social protection benefits, Sub-Saharan Africa is among the regions with the very lowest coverage. We have few countries which have specific social protection benefit for persons with disabilities, but most of them are, poverty targeted, they're household targeted, they have less coverage, and don't look at disability-related costs. But we have a few exceptions in countries like Namibia, South Africa, and Mauritius, which gradually are moving towards even looking more at disability-related costs when looking at social protection. So again, very few countries in Africa have national disability registry, making it extremely very difficult for persons with disabilities to access social protection schemes. So during this pandemic, we've seen a bit of bits and pieces of good practices across the region, which is quite promising. So for example, in Mauritius, we have home delivery of food to households of persons with disabilities. In South Africa, there's an increase of disability allowance. In Kenya, we have additional temporary disability scheme for 3 months. In Sierra Leone, they have a very nice initiative known as the Veronica Buckets, which distributes rice, other items, and one-off cash payment, among other countries. So very promising. Moving forward, if we look at the Kenyan context, can we change the slide, please? So looking at the Kenyan context, in Kenya, looking at pre-COVID-19, we have a social protection program known as Inua Jamii. Inua Jamii can loosely be translated to mean lift the community or strengthen the community. And the objective of the Inua Jamii program is to provide a social protection system through regular and predictable cash transfers to poor and vulnerable households, at the same time to build their capacity to live together. So the program has 3 cash transfers. One is for older persons, the other one is for orphans and vulnerable children, and then we have a cash transfer for the households of persons with severe disabilities. So all of the 3 cash transfers, they are poverty targeted, but when we go to persons with severe disabilities, there is more eligibility criteria when one has to benefit from the social protection program. So number 1, the recipient must not be, a recipient of a pension or reasonable income, not recipient of any other cash transfer, must be a person who requires 24-hour care, and a very, very important component under the eligibility criteria for persons with disabilities is that one must be registered with the National Council for Persons with Disabilities. So the National Council for Persons with Disabilities is a state corporation which one of the mandates is to register persons with disabilities. So the registration process is quite tedious for many persons with disabilities and their families. So number 1, one has to fill in registration form. You have to book an appointment for the assessment. The assessment is done under a medical team. And then this medical assessment is done from level 3 hospital to level 5 hospital. So level 3 is at the district hospital, and level 5 is at the national level, like in the cities. And then there's a payment, which differs from one hospital to another. So there are some hospitals which charge like around $3. Some hospitals charge as high as $10. The medical team doesn't sit every day. So in some hospitals, it sits once a month. In some hospitals, it sits like twice a month. So you can imagine the number of people with disabilities who wait to be assessed with the medical teams. Then once a person has been assessed with the medical team, the medical team prepares a medical assessment report. And this medical report is shared to the Director of Medical Services within 3 months of the assessment. And then the Director of Medical Services will then issue a recommendation whether a person should be registered or not. So in this process, we've seen a lot of barriers faced by specific persons with disabilities, especially persons with intellectual disabilities and psychosocial disabilities, due to their nature of disability, which is an invisible disability. So if a person is coming from a background where a disability has to be seen for one to be considered as a person with disabilities, then it puts so many persons with intellectual and psychosocial disabilities at a very tricky angle that, you know, they have to justify more why they have to be registered as people with disabilities. Then once the recommendation is approved, then the applicant or the Ministry of Health will then submit the medical report to the National Council for Persons with Disabilities. Then a person will be issued with a disability card. So again, because the issuance of the disability card is not central, is not devolved, it is only done here in Nairobi. That means that, you know, people have to wait for between 3, some people have said they've waited for 18 to 24 months to get a disability card. So quite a number of barriers when we look at, you know, the eligibility criteria for one to get or to access social protection benefits. So the disbursements of cash transfers are done every other month using mobile money. And when we look at every other month, then it seems that, you know, a person has to wait for almost 60 days, or a household where they have person with severe disability has to wait for almost 60 days for one to, you know, to access the next, you know, cash disbursement, which again, if we look at disability related costs and all that, it puts more and more persons with disabilities and their household at a very, very tricky situation again. So to date, 52,000 persons with severe disabilities have been reached with the cash transfer program. This is 5% of persons with significant disabilities. So in 2019, Kenya did a census, and in the census, the disability data was collected using Washington short set of questions. And the total population is about 900,000. So again, looking at 5% of persons with significant disabilities accessing the social protection program, and we are seeing that the coverage is very, very little, and then the amount is $20 per month. Next slide. So looking at COVID-19 response to persons with disabilities and their families in Kenya, the National Council for Persons with Disabilities set aside around 200 million Kenya shillings to cushion 33,333 persons with disabilities against the effect of the pandemic. This is a short cash transfer for 3 months between June to August 2022. Again, the amounts are the same, $20 per month. So by the end of 3 months, households of persons with disabilities will receive $60. The criteria for this, again, must be poor, not benefiting from any other government cash transfer. They must have a valid identity card, and this is for people who are 18 years and above. For children with disabilities and also adults with disabilities, they must have in addition a disability card, active telephone number, and then priority was given to households with multiple vulnerabilities. So persons with severe disabilities who also have other, you know, vulnerabilities, including diseases or old age, issues of gender dimension also came into play and all that. So the targeting was done at the community level, and it involved a multi-agency approach. And this is one thing that was really striking is that this approach then meant that, you know, the local administrators had to get hold of, you know, like local DPOs, start having conversations with them, like how do you support us in identifying persons with disabilities in your localities? And I think this is something moving forward. This is, you know, this is an example that it will be very good to pick up, even looking at, you know, post-COVID-19, like how are DPOs engaged in the identification process, determining, like, even amongst themselves at the community level, like who's deserving of, you know, the cash transfer. Then data validation for this was used using National Safety Net Program and integrated population registration services for authentication and checking on duplicates. So again, this was like really insisted by the government that they really have to validate whether a person is already receiving another cash transfer or not for them to be recommended for the COVID-19 cash transfer response. So my last slide, I'll be looking at some of the key messages that I would want to leave you with this afternoon or this evening. So number one, looking at even the Kenyan context and the registration process of persons with disabilities and the disability assessment itself and getting of the disability card, there's need to localize the whole process, make it more accessible to many persons with disabilities. So like in Kenya, we've seen people even moving from one district to another, just chasing like which medical board is sitting on a certain day, because I know like if mine passed, then I really have to identify which other district near me is sitting next so that I can go there. And in the process, people are using a lot of money on transport, accommodation, and the whole process of acquiring the disability card. Then there is need to invest and develop community support services. So just looking beyond like participation and meaningful inclusion of persons with disabilities in the communities. Then number three, again, very important, the involvement of persons with disabilities, their families and respective organizations, right from the design of social protection programs to monitoring of it. And then disability social protection schemes need to be compatible to the right to work and socio-economic inclusion and social inclusion, and looking at a person with disabilities comprehensively. Then the last one is the targeting and criteria to focus on disability support and participation. So like if you look at the Kenyan context again, the disability assessment is more on looking at the impairment and not looking at like the supports that are required for a person to live and be included in the community. And then most importantly, this should also foster personal autonomy, independence, and choice of persons with disabilities. So thank you very much. Back to you, Felicity.
Thank you, Fatma. We'll have another little pause while the interpreters and the captioners catch up. And next we have Josito from Timor-Leste. Oh, also, we've had a few questions about the gallery mode. So if you do need to see the sign language interpreter, you can swap from gallery mode to single view mode. You need to scroll along the gallery mode and find the sign language interpreter to focus on that screen. Please send in some more questions if you're still having troubles. Over to you, Josito.
Yep. Okay. Thank you, Felicity. Good evening from Timor-Leste, and good morning, good afternoon, maybe there. Yes. As we know that Timor-Leste is a small country and is just around 20 years old, independence. So people with disability in Timor-Leste is about, based on the census 2015, is 38,118 people living with disability from 1 million, more than 1 million population here in Timor-Leste. Next slide, please. Yeah. Timor-Leste is one of the poorest country in the Southeast Asia region, with a third of the population living on less than $2 per day. So, party line in Timor-Leste that people with disability and their families still more likely to be poor due to the additional costs, transport option, and opportunity of employment. So many of people with disability are choose to be establish the self-help group or involved in the private activity or program. So some of them are working in the disabled people organization. Very less of them are working in the government sector, even though that number is shows that about 4,000 people with disability working in the government sector. But in Timor-Leste, there are accessibility is still very poor in the government institution. So access to health facility that's still be considered to be inaccessible. People with disability living in rural area face extra challenges because the distance of health posts and lack of access to the transport. People with disability in rural area, they are very difficult to access for the employment and also work. They more likely to be depending on their family support. Even also clean water and other things are very difficult for them to be accessible. I minimize. So the, sorry, can it be back to the, okay. So based on the economic activity that I just mentioned, that, you know, sorry, I have to say that it's about employment, employee of person with disability in the government sector is 1,416, and private employees about 3,000, and you know that the other employers are about 56. So those are based on the census 2015. But you know that many of them are still, the data is not reflected to the Washington Group question. So it's not really clear that, and not really clear and not really accurate data to be used. So yeah, next slide, please. Yeah, social protection during the COVID-19 or pre-COVID-19, there are in Timor-Leste, there are Bolsa Damai, we call is the mother of the pocket of the mother. That's the conditional, that's the cash transfer program is for children from age 6 to 15 years of living in poor and vulnerable household. So there are about $5 per month for up to the children per family, included person with disability. About 10% of children with disability access for the this subsidy. Support of the elderly and disability pension. There are about, the program is about, for elderly is about age 60 years old, and also person with disability should be age 18 to 59 years old. So every month, the cash transfer is about $30 per month. So, but that they have to be collect every 6 months. So it's about $180 per 6 months. So it's covered for 20% of persons with severe disability. In Timor-Leste, they are using International Classification of Functioning, ICF, to classify person with disability. So only the person with grade 3 and 4 are access for this pension. So grade 1 and 2, they will not access for this pension. There's also have a veteran's pension is considerably that higher than the person with disability subsidy and also elderly. It's start from more than $200 per month. So it's a no disaggregate data. Next please. The impact of the COVID-19 for people with disability are most vulnerable group and the risk towards the coronavirus. For example, we know that in Timor-Leste, there are hand washing facilities in public are not accessible, whether in urban or rural area or settings. During the lockdown, persons with disability had difficulty accessing medical treatment and even the medical store. Magnify of persons with disability that also have HIV, hepatitis B, or leprosy and others disease. So they are very difficult when they are living in rural area to access for the medical assessment. So there also is a very difficult for the transportation that people with disability or those are with HIV or hepatitis that from rural area to the city, to the Dili, to access for the medical treatment and also get the medicine. That's a significant loss of income individual and at household level that people with disability in rural area are facing significant issues. During lockdown, their absence of transport means lost their income generation activity because of they did not access to the market. So when I asked one of the Aristio client that living in the very rural area that he is complaining about that with his tricycle that getting broken and it's very difficult for his because he's very dependent to his tricycle to movement and also to do the mobility and also to do the negotiation and also market. During the COVID-19 pandemic, the state is locked down. He is facing that he cannot doing any movement because of his tricycle is getting broken. And when we are called to him, and it's very difficult for us to visit him. So, and he is facing very difficult to get in money to get some to buy some food. It's about just an case study that we face in the COVID-19 pandemic. Next, please. So the government support is very low for persons with disability. Even the government are not considering to the inclusion needs for persons with disability as a marginalized group. You know that the COVID-19 subsidy, that was Aristio doing a small observation and also to collect some data that many of people with disability are not really considering to get a COVID-19 subsidy. So no increased value of coverage of the disability pension and elderly, inaccessible information, inaccessible hand washing facilities. That's people with disability still facing left behind. So many of the hand washing facilities in around the place, but no one is accessible for people with disability. And even those with blind are very difficult. People with blind are very difficult to access for the hand washing facilities, and also lack of information for person with blind and also deaf. Only some intervention from the international non-governmental organization and also disabled people organization to provide humanitarian support during the COVID-19 pandemic, such as delivering food and also washing hand facilities, face masks, and other basic needs. RSTU has distributed material for COVID-19 in some of the municipality that's to be doing the prevention and mitigation, such as face mask, soap, poster for COVID-19 information and food. Intervention of distribution of food is in the 7 municipalities and also 40 villages. So, yeah. Next, please. As I mentioned, that the subsidy for families and household, there is this subsidy is under by Ministry of Social Solidarity and Inclusion. There are some of the barriers that people with disability face. There are lack of requirement of the documents. People with disability are not married, and they do not live in established household. Some people with disability have established family, but they don't have household, family, and family car. So many of women with disability have children due of the violence, sexual violence, but they don't have access to this subsidy. There is also a long bureaucratic process, lack of accessible information from community leader, family don't support, assist them to process their document. Some person with disability live with extended families, but they register them to get higher benefit, but they don't share, the family members don't share the benefit with them. So some people with disability asking to RSTU how people with disability also benefit from this COVID-19 subsidy. But this subsidy is only for those who are established family and they have a family card. So this is what the situation happened in Timor-Leste. Next, please. So the recommendation or demands, we would like to recommend that advance or extra payment of benefit during the COVID-19 need to be considered as part of the humanitarian support, not only for household support, for income under 500 per month. So this is only for those who can be benefit from the COVID-19 subsidy if the salary are minimum or less from the 500. Need to be develop and improve payment system and also update data for humanitarian support in the future. Need to extend eligibility to the disability support allowance to those who are assessed with disability in grade 1 and grade 2. If they are grade 1 and grade 2, but if the family are poor, they might be also have to be to have the right to cover from the subsidy or from the social protection. Need to be improved access to health system and facilities, have to be adequate medicine for those vulnerable people, of course, people with disability living in rural area, accessibility and enhanced washing facility and information system are very important to be considered. Need to be reducing in the bureaucracy system of the responding of the humanitarian system to be considered. That's to be accessible and inclusion for all. Thank you.
Thanks, Josito. That was great. It sounds like some users are still having trouble with seeing the sign language interpreter. If you don't have the gallery mode, there is another option to click on side-by-side mode in the view options menu. So give that a try and hopefully that will remedy the situation. So we're on to our last speaker now. And we have Karishma from Indonesia. Over to you, Karishma.
Thank you to everyone. As Felicity mentioned, I work for Mahkota. Mahkota is an Australian government-funded program supporting the government of Indonesia to strengthen its national social protection policies and programs. Sorry, just trying to change the slide. There we go. My team, in collaboration with the DPO network and another Australian supported program, Compact, has been undertaking a very interesting research agenda to understand how COVID-19 has been economically impacting people with disabilities in Indonesia and the extent to which they are benefiting from the various social protection responses. And what we are seeing from the research is that around 60% of people with disabilities that the research covered are engaged in informal work. They have unpredictable income sources and earn less than around 100 Australian dollars a month. Given this situation, they're highly susceptible to an income shock in the face of any crisis. Now, given the precariousness of informal work, unsurprisingly, 97% of informal workers with a disability are experiencing a decline in income as compared to 67% of formal employees. Now, while that's to somewhat be expected, I think what's more striking is the extent to which people with disability have fallen into poverty or become poorer during COVID-19. So what we're seeing here is, if one has a base income of around $100 a month and they experience an economic decline of around, between 50 to 80%, they're being pushed into a situation where they can no longer meet their basic daily needs. And this is happening to nearly up to 3/4 of the respondents to which our research is speaking to. Now, the good news is that the government of Indonesia was able to build on its very strong social protection system and respond with various social protection mechanisms. Now, this is just a quick snapshot of the various response mechanisms that are in place. And the light orange boxes are the various cash transfer schemes. And for instance, Sembako, which is the food assistance program, has increased its benefit level by 33% and now covers up to 30% of the population. So we see that the government of Indonesia is injecting a lot of cash into the economy to help people cope with this crisis. And as of April 2020, that's when the quantitative data was collected for our survey. And at that point, we saw that around 40% of respondents were accessing at least one of the 3 schemes. At that point, there were only 3 major schemes on offer. And around 40% were accessing at least one of those three schemes. And we saw that the electricity subsidy had the greatest coverage of people with disabilities. And this is mainly because of its self-registration mechanism. And by July 2020, and this is when we started the qualitative research, we saw that the situation was getting even better. And this is because of, obviously the growing number of programs, the increase in number of beneficiaries. But more importantly, I think that this layering of cash transfer programs that the government had. So there were national level cash transfer programs, but also local level programs at the provincial level, district level, and even down at the village level. So for instance, the BLD Dana Desa, which is the Unconditional Village Cash Transfer Fund, empowered local communities to identify those who've been missing out on national schemes and basically fill these gaps. And many local communities have been prioritizing people with disabilities because they have been falling through the cracks at these higher levels. Now, you can imagine for those who were earning around $100 a month or less, the fact that they could now, get around $60 a month from these temporary unconditional cash transfers acted as a lifeline for many people with disabilities that were economically affected. But this was not the case for everyone. And we are seeing that many people with disabilities have been slipping through the cracks, like Una. So just to give you just a quick snapshot of one case study, Una is a 65-year-old single mother supporting a child with multiple disabilities. She works as a cook in a restaurant, and she was earning about $2 a day pre-pandemic. And since the pandemic, her wages were cut by about 50%, meaning that she no longer earned enough to support her daughter's needs, and her daughter's condition has been getting worse. Una and her daughter have not received any social assistance. She's aware of the COVID-19 response schemes and has complained to village officials, but was told that beneficiaries are determined at a much higher level. So I think on the back of this, we really have 3 main recommendations to ensure that economic recovery is not just progressive, but also systematically more inclusive. So the first of those recommendations is to introduce a national disability benefit where people with severe disabilities can self-register and then be evaluated to determine their eligibility. And this would help ensure that thousands don't necessarily slip through the cracks, and there would be a systematic approach to providing cash transfers to everyone that's entitled to one. The second is, I think, moving away solely from poverty-targeted databases that mainly target households. And we know that many of these databases miss out on vulnerable individuals like people with disability. Rather, we need to move towards more disability-sensitive data to inform social protection beneficiary lists. But the good news is that Indonesia is already moving in this direction, and a disability database and a disability assessment are already underway. And the last recommendation is to engage with DPOs at the local level to inform policymaking, to disseminating information where we see a lot of people with disabilities. The local level might not know what's on offer or how to apply for them. And really just to play that role in ensuring that the last mile of social protection benefits actually reach people with disability. So thank you. I'll stop there.
Great, thanks, Karishma. Thanks to all our wonderful speakers tonight, and we'll move now into our question and answer session. So we've got a few questions coming in on the Q&A chat bar. So if you have any questions, send them through now and we'll see how many we can get through in the next 15 minutes before we have to wind up. And just a reminder that we will answer all the questions and put the answers up on the website with the recording of the webinar. So the first question that I'll go to is from Levjen. It says, hello and thank you for your presentations. She would like to know what support is given for people with missing IDs or other documents, like internally displaced people or homeless people. Are they left without any government support? And secondly, and I might direct this one to you, Alex, you mentioned community support. Is it better if it is based on formal or informal relationships? We have some cases reported where people spontaneously started helping their neighbours with disabilities. Is it good to try organising them into a formal volunteer group or joining an NGO, or better to just leave it as it is? I'll hand that one over to you, Alex.
Thank you very much, Felicity. So with regards to the issue of valid ID and official registration, it's indeed a big issue, which is not solely a problem for persons with disabilities, as we know, but many people. I would say that there are things that government can do. I just would like to highlight the approach that the government of Fiji took in the last 2 years. When they worked with DPOs to identify people with disability who would benefit from disability allowance. And they carried out, with home visit, the disability assessment. But in addition to that, they got in the team people responsible to provide the ID, as well as opening bank accounts and telephone lines, so that the person doesn't get bogged in between different eligibility criteria and documentation, but actually there is a proactive effort from the administration to ensure that this is all done in one go. And this has proven to be extremely effective as an approach. With regards to the issue of community-based services, it's very clear that in low and middle income countries, there is a significant space for informal support and community support. But make no mistake, more than half of the support in high-income countries is provided by family and friends. So this is something that is true everywhere, but even more so in low and middle income countries. And I think one of the big challenges we are facing, and which COVID really highlighted, is what happens when the family cannot support anymore. And this is the importance of how social protection systems can help formalize this community support, this spontaneous support, which may not be always available, which not always, I would say, the quality of the support might not always be there. So it's how social protection system and social work can support community to do the right thing, and how they can leverage each other's resources. And there are work, for instance, around community-based inclusive development, community-based rehabilitation, which are doing this kind of work, circle of support for persons with intellectual disabilities. But there is not enough connection between those informal or community initiatives and the formal social protection system. And this really weakens first the sustainability, but also the coverage of such approach. If you are lucky, you are in a village where it happened, and if you are not lucky, you are in a village where it doesn't happen, and actually you will get nothing. So that, I think, is how the formal social protection system can work more with community-based organization to support the development of such support and services in the community is extremely important. Thank you.
Great, thank you, Alex. Okay, the next question is from Hazel. And I'll direct this question to Karishma, please. So information dissemination is critical in all aspects and phases of COVID-19 response. Can you share some strategies or good practices by government or non-government entities to ensure that information is disability inclusive?
Yeah, thanks for that question. There is currently because of the decentralized nature of social protection delivery in Indonesia, I think there is a lot of drawing down on facilitators, but also working with local organizations, both at the district level down to the village level, to ensure that information on social protection mechanisms gets communicated. But I think it still remains a big gap. Indonesia is decentralized, but it's obviously a very vast country. Those that aren't living just directly, perhaps near the district center or around the periphery, getting the word out on social protection mechanisms is difficult. In the best of circumstances, reaching out to people with disability and other very vulnerable groups in more remote locations still remains a challenge. I think hence my recommendation there to really use DPO networks much more. I think there is a need to build on the actors that are already at the grassroots level to ensure that there is better dissemination of information, and that last mile messaging, so to speak, is done much more effectively.
Thanks, Karishma. Okay, the next question is from Martina. So this is directed to Alex. I wonder about how we can reach those who most need these schemes, but rigid processes of registration and confirmed status makes it really difficult. I think this is the same in all countries, not just lower middle income countries. When we advocate to governments, or as we in Save the Children provide actual cash assistance ourselves at times, how should we best work to identify persons or households with disabilities in need?
Thank you very much. This is indeed a critical element, and we got in the last 3 months a lot of requests with regards to that. I think that there is a key issue with regards to routine surveys or assessment that are carried out by social protection programs, programs that are not specifically targeting persons with disabilities, how best they can make this first level of identification. And basically, there are, for instance, the Washington Group short set of questions, which can help identify many persons with disabilities. There are additional questions that have been developed that can help, for instance, capture more persons with psychosocial disability or intellectual disabilities, which can be missed. But we believe that there is a need of a staged approach. Is that based on the data that you might get from those first surveys, you can already identify many people who are likely to have a disability. And then this can be used as a referral to community disability assessment. And I think this is one of the biggest issues that we have seen in India, in Kenya, in Timor-Leste. It's the fact that because the social protection system is focused on medical assessment and incapacity to work, they miss a lot of people who do not have the resources to go to the system. So for instance, India carried medical assessment camps, having those kind of mobile, but we see it as, it helps, but it doesn't solve the problem. And what we are seeing now with countries like Fiji, Vietnam, or others, is basically the idea that the medical assessment, which is actually a barrier to accessing the support, is not a prerequisite anymore. That actually community workers with adequate instrument and tools can carry out basic disability assessment and identify a lot of people. So for instance, I go back to Fiji because it's the most recent example we have, but in less than 2 years, they succeed to cover 1% of the working age population, which is pretty significant. But one of the reasons, so first they adopted a flexible approach, community level, not medical assessment as a prerequisite, but they also work very closely with organization of persons with disabilities, which help also reaching out. And I think that we had also in the question issues of person with deaf blindness, for instance, which are pretty much invisible. because you don't see them in the community since they have very little support. And if you are not connected with organization of person with deaf blindness, you are very likely never to hear about them or to detect them or to have them in systems. So having this combined outreach is probably one of the best way of moving forward.
Great, thanks, Alex. We have a question here from Trisha. I might direct this one to Meenakshi, if that's all right. So thanks for the great presentations. Are any of the speakers able to tell us more about the gender dimensions of access to social protection programs? Is disaggregated data being collected and used, or is this a gap that needs better addressing? Over to you, Meenakshi.
Yeah, so I can, thanks, Felicity. So I can give this from the perspective from India, because I know what's happening. As the gender disaggregated data is not available, both for women with disabilities and girls with disabilities, both within the women specific program, and as well as it's not available in the person with disability specific programs. The social protection program, in our analysis, what we found was for women with disabilities specifically, what we found was that it's not responsive to address the various issues experienced by women with disabilities, due to gender intersectionality or disability. So, and there are no specific program for women with disabilities. So to give some example, there is one program which looks at assistance, social protection assistance during pregnancy in India, but this includes women with disabilities, but it has not taken into account the specific support requirements and barriers experienced by women with disabilities. Similarly, when it comes to violence and abuse and domestic violence per se, there is a general procedure for women to access the community respite centers. But when it comes to women with psychosocial disabilities, these centers are not open. So we find some discrimination even among women with disabilities in this. So the major issue is there is no gender disaggregated data, no specific programs for women with disabilities, and the general programs both for women as well as for persons with disabilities are not responsive to address the barriers experienced by women with disabilities. This is the situation in India, but I find it's true in many countries, because we couldn't find many resources to understand actually the status of access to social protection by women with disabilities, because most of the studies are centered around abuse and violence and sexuality and reproductive health care denial as far as women with disabilities are concerned. Thanks.
Great, thanks, Meenakshi. Okay, our next question is for Fatma. Do you find that social protection systems have accessible grievance redress mechanisms or complaint mechanisms that persons with disabilities can use to make their complaints?
Unfortunately, they don't have. So like just in Kenya during this pandemic and the cash transfer for cushioning persons with disabilities against the effects of the pandemic, so many other people were left out. And we've really been trying to engage with the local administration just to get to know, like, from the recommendations we made, why were other people left out? Unfortunately, none of them was able to respond to us. We were referred back to the ministry and the National Council for Persons with Disabilities. And even then, with both, the ministry and the National Council for Persons with Disabilities, we haven't received any feedback yet on why some recommendations were denied. So basically what I can say that there are no redress mechanisms, and this is very, very dangerous. I think moving forward, social protection systems need to have, redress mechanism, and also for people just to be given feedback. Why was their, application refused? Thank you very much.
Great, thanks, Fatma. I'll make this the second last question. I'll address this one to Josito. Do persons with disability have a legal entitlement to social protection in Timor-Leste?
Okay. Thank you, Felicity. In Timor-Leste, the government of Timor-Leste have a disability, elderly and disabilities pension or subsidy. That is under decree law that's been by Minister of Social Solidarity and Inclusion, and also under working with Ministry of Health. You know that's the process is a bit bureaucratic and also a bit complicated. You know that's those people with disability are going to be access for the or eligible to access for the disability subsidy. They have to have they have a registered in the identity card. They call not national identity, but they call using the electoral card. It's under the Ministry of Administration. So when you have to get this card, but before you get this card, you have to have a kind of the birth card. Okay, so the birth card will be processed you to get the electoral card. After that, and then it will be have to go to the Ministry of Health to test your disability. So using International Classification of Function, ICF. To make sure that people with disability are in the grade 2 or 1, 2, or 3, or 4. If those are with grade 2, 1, and 2, they will be not eligible to get this subsidy, but only for those are grade 3 and 4. But not eligible for children. So with age 17 years old, they will not get the disability subsidy. So only those are with and after that, if the doctor is the doctor already identified that those person with eligible in the grade 3 and 4, then go to the Ministry of Social Solidarity and Inclusion. They call to be go to register or input in the disability data in the Ministry of Social Solidarity and Inclusion. So what happened during the COVID-19, they don't use this subsidy to respond for person with disability. They are waiting for another cash transfer, what they call is COVID-19 subsidy. It's different from disability subsidy and elderly subsidy. So, and people with disability have to be waiting for till 6 months. After that, they will be get access to the disability pension. So it's a bit complicated in Timor-Leste. Many of people with disability they don't understand about the information. They even they don't access to the information about clear information of the access for the COVID-19 subsidy. and those are living in rural area will be more poor for the information. So this situation is very, very terrible. And coming up also, those are, you know, that if anyone is getting 500 salary plus $1, then will be not access for the COVID-19 subsidy. So the salaries have to be 500 less for household. Okay, so this is the things that happen in Timor-Leste for during the 2 months of the lockdown or of the state emergency for the COVID-19. So it's coming to be still continue for the lockdown, but it's only for the only for the borders. So I think that's happening in Timor-Leste. Thank you.
Thanks, Josito.
Yeah.
It looks like we've run out of time for having some more questions and answers. So we'll make sure that we get back to you on any outstanding questions that you have. I invite you all to also answer the post webinar survey, and the link will appear in the chat bar shortly. Remember also to join the Social Protection and COVID Responses online community. So the link again will be made available in the chat bar. Please join us again on the 29th of September for the next webinar in the disability series of inclusion of persons with disabilities in social protection for COVID-19 recovery and beyond. In the next webinar, we will be diving into some more technical issues on disability identification and assessment, as well as cash and how community services can also be drawn on to provide support to persons with a disability. Also, keep your eye out for some resources and guidance materials on disability inclusion and social protection, which will be going up on the sp.org website over the next week. I'd like to thank you all very much for joining us tonight, and hope we see you on the 29th of September. And I'd also welcome you to give a round of applause for our wonderful speakers tonight, for our sign language interpreters, our captioners, and our IT assistants. Thank you all for joining us, and hope to see you again soon. Good night.
Thank you. Bye.